Have you had a liver function test come back with unusual results? Understanding what those numbers actually mean can feel overwhelming, so let's break it down together. Your liver works constantly to process everything you consume, including alcohol. When you drink heavily or regularly over time, fat can start to build up inside liver cells. This is called alcohol-related fatty liver disease, or ARLD, and it's the earliest stage of alcohol-related liver damage. In many cases, there are no obvious symptoms at this stage. You might feel completely fine. That's what makes routine blood tests so valuable. They can pick up changes before you'd ever notice anything yourself. So where does the AST/ALT ratio come in? AST and ALT are both liver enzymes. When the liver is under stress, these enzymes leak into the bloodstream, and your GP can measure them through a standard liver function test. In a healthy liver, ALT is usually equal to or higher than AST. But when alcohol is the cause of liver stress, a characteristic pattern tends to emerge. AST rises more than ALT, pushing the ratio above 1.0 and sometimes above 2.0. There are two reasons for this. First, chronic alcohol consumption depletes vitamin B6, which the liver needs to produce ALT, so ALT activity actually falls. Second, alcohol damages the mitochondria inside liver cells, releasing additional AST into the bloodstream. The result is a higher AST relative to ALT. It's worth knowing that AST isn't liver specific. It's also found in muscle, heart tissue, and other organs. So a raised AST doesn't automatically point to the liver. Your GP may check other markers, like creatine kinase, if muscle injury is a possibility. When the ratio exceeds 2.0, this can strongly suggest alcohol-related liver disease, particularly when another enzyme called GGT, or gamma-glutamyl transferase, is also elevated. GGT is sensitive to alcohol, but it's not specific. It can also rise with certain medications or other liver conditions. That's why doctors look at the full picture rather than any single number. By contrast, non-alcoholic fatty liver disease typically shows ALT higher than AST in its early stages, giving a ratio below 1.0. Though it's worth noting that in more advanced fibrosis or cirrhosis from non-alcoholic causes, this pattern can shift, which is exactly why results always need clinical context. If your liver function test has come back outside the normal range, the most important step is to speak to your GP. Don't try to interpret results in isolation. Your GP will look at your full clinical picture, your alcohol history, GGT levels, imaging, and other parameters before drawing any conclusions. It's worth having an honest conversation about your alcohol intake. If you're regularly drinking more than 14 units a week, or binge drinking, that's something to raise. Clinicians aren't there to judge. They need accurate information to give you the right support. The encouraging thing about ARLD at this stage is that it can be reversible. Reducing or stopping alcohol gives the liver a real chance to recover. But if drinking continues, damage can progress to fibrosis, cirrhosis, or more serious liver disease, which is much harder to treat. You should contact your GP promptly if you have persistently abnormal results, significantly elevated enzyme levels, or any symptoms that might suggest more advanced liver disease, things like persistent fatigue, abdominal discomfort, yellowing of the skin or eyes, or unexplained swelling. Referral to a hepatology clinic is recommended when liver tests remain abnormal over time or when there are signs of more advanced disease. To recap, an elevated AST/ALT ratio, particularly above 2.0, alongside a raised GGT, can be an important indicator of alcohol-related liver stress, but no result should ever be interpreted without guidance from a healthcare professional who knows your full medical history. This video is for general information only and is not a substitute for advice from your GP or a specialist. If you found this helpful, leave a question in the comments, give the video a like, and subscribe to Bolt for more medically reviewed health information.